Hi everyone, thank you for joining us on our Friday chat. I'm Maud, I work at Perfect Balance Clinic, and this is Jenny joining me today. She's a sports therapist also at Perfect Balance Clinic. So today what we're going to talk about is back pain. So back pain is one of the most common sort of pain and issue that people are getting, and it's one of the most common that I see in clinic. Um, I see low back pain and back pain in general almost every day on a daily basis. Patient coming in and complaining of that. It can be a new onset. It can be something that they've had for years and years. Nonetheless, they still need our help, and it's really debilitating to have this. So we'll try to go through anatomy of the back. We'll then go explain a little bit what can cause your back pain, and then how we can treat it and how you can do some exercise for it as well. So
Yeah.
thank you for joining us, and we'll jump right on it. So the anatomy of the back. So the back is made of different vertebrae. Oh, nice. Perfect. So that's basically the whole length of your back. Right at the top, there's the skull. And then from there, you get the vertebrae that are aligning top to bottom all the way to your sacrum, which is your tailbone. And that's the last bit of your spine. All in between, you have the top bit, that's the cervical spine. Middle bit, yeah, middle bit is the thoracic spine. And then the lower bit is the lumbar spine. So we see lots of problems within different region. I think we might concentrate maybe on lower back today, so lumbar spine more problems that are, I think, one of the most common problems that we see. The little yellow bits that you see on the model here, that's the nerve that's coming out of the spine. So you can see how at each segment you have a bundle of nerve that's coming out. Those nerves will go into all of your body. So from the neck, they'll go down into your arms. From the lower back, they'll go down into your legs. And then one important structure as well, in between those vertebrae, you get what's called a disc, and that's the little spongy bit in the middle. So that's where you can see it's a bit transparent in the middle, and that's one of the cause of back pain as well. That's really common. Um,
So
and
your so your lumbar spine. I guess what we have to say, although the spine is split up into 5 different sections, not to get a lot of people just get bogged down with treating one individual part of the spine. What we've also got to remember is the spine is linked. It is kind of one whole long kind of chain of discs and vertebrae. So what sometimes you might find, although you've got a problem, let's say in your lumbar spine that we're talking about, you might then get some sort of restriction a bit higher up because it's linked, it's not moving properly. Your lumbar spine in particular, it has 5 vertebrae, 5 discs. And usually when people get the problem in the lumbar spine, it usually affects the lower part of the lumbar spine, so kind of right at the very bottom. So we're talking like pelvis level. A lot of people kind of say about the little dimples that they have in their back, or like the two bones that stick out. So it's usually around that area. Yeah.
yeah, so all around there, you then have muscles stabilizing around. So you have little ones, and then you have big ones actually that come from the bottom, and then all the way attaching to the top of your neck. So that's how as well it works all together. So when you move, all of that is going to do a continuous movement. So that's why sometimes when you have low back pain, when you do some movement, that's when it's very painful. But you can also feel some people come in and they're like, actually, I can feel it all the way up. It kind of go up as I move and things like that. So that's why the pain can be quite diffuse and sometimes go in bigger areas than you would think. So that's basically the anatomy of the lower back. And now, if you think about what can cause pain in the lower back and how you can get it, um, I think one of the main thing that I see is a disc problem. I don't know if you see a lot of those, but disc-related problems. So the disc, remember, is a little squishy bit in the middle of each vertebra. What can happen? You can have repetitive injury on it, so just loading it a lot, so you get that squishy bit that gets pushed in, and sometimes can have a little bit of a tearing through it. And that can cause something on the lower back. And it can also irritate one of the yellow bits, so one of the nerve that passes by. That's typically what happens when we say sciatica. So that would be the disc is irritating one of the nerve, which is the sciatic nerve, which is the nerve that comes on your buttock all the way on the back of your leg and the back of your calf. So that's really common, and you see a lot of people with that when they come in with, I have sciatica.
Yeah.
Sometimes it's not that, so that's why we need to do a bit of digging to know exactly what's happening. But if it's that, it's knowing where it's coming from. So sometimes it's coming from that disc, sometimes it's coming a bit lower down, but it's irritation of that nerve as it passes through.
Yeah, so I think for me, I see being a sport therapist quite a lot of the athletes. So the back problems that I see is usually because of overuse. So as you kind of were saying there, if you've taken up maybe a new exercise, or maybe changed surface, or changed kind of how long you do an exercise for. So for example, let's say you've not really ran before, you maybe just so every now and again go for long walks with your family, and maybe do like a 5K once every fortnight or something, once a week. And then during lockdown, you've decided to go out road running a couple of times a week. That is quite high impact. So all of that shock that's coming from kind of your foot strike comes all the way up through your spine, and that's where you can get that impact through the disc. And that's usually what I see, because they've just more irritated the structures in the spine, and that's usually because they've either done too much or they're actually weak around that area. And the weakness that we talk about towards the end when we talk about exercises and treatment is more to do with your deep core stabilizing muscles, your glute muscles, all of the muscles around your pelvis and lower back. But I think you probably see more of the people that do their back. They usually come in and say, from maybe, I don't know, a sudden quick movement or lifting something heavy. Do you see?
Yes, usually it's been a while that maybe they start to feel a bit of a niggle, or they're doing lots like a different activity, and then they do that movement and suddenly they have this sharp pain arriving onto their back and they just can't move. And that lasts for a few days. It tends to go a little bit better, or some people it just doesn't get better and they come to us just kind of completely immobile and not being able to move. So I see a lot of those, and that's just usually from bending or pulling things. So it's like if you bend it down and then trying to lift a very heavy bag, a very heavy, stand by anything, a very heavy object, and that means your back go, like they say. That's kind of the typical sign as you get for like this. A disc usually take a bit longer to get better, so that's why it's a bit of these annoying injuries that it takes a bit longer to heal. So it's going to take a little bit longer session as well to get better. Whereas, for example, if it's a muscle strain or another part of the joint that goes a little bit faster to get better. So I get also a lot of people that have had this injury 20 years ago, and since then they're just getting on and off low back pain, every year or every 3 months. It's coming back. That's really common as well. It's just coming back, and like every time you try to push a bit more, to do a bit more things, it just comes back. You just get the pain again. So that would be really working with prevention and rehabilitation. So it would be, as Jenny said, it's going to be really retraining your back to be stronger, to be able to do those lifting, to be able to support itself, to avoid having that coming back every 3 months or every year. You get that period where you're like, oh, it's clean back, it's all the time the same, and I get this pain on my leg. So yeah, so we can do something about that as well, about the reoccurrence of low back pain. Even if the injury was years and years ago, there's still things that we can do now.
Yeah,
For
so I think going on from that, if we talk about kind of the main, we've already touched on disc, but there's kind of a few main injuries that can happen to the spine. So as Maud has said, the disc can either, a lot of people say slip disc. The real kind of terms for this is disc bulge, disc herniation, prolapse, depending on how severe it is. And that is, as Morg was saying, you irritate these little squidgy structures. I usually describe them as being a bit like a donut, so like a down donut. And if you compress it too hard, so if you're lifting up something that's too heavy and you compress this donut, sometimes the jam can come out. So that's kind of the same with the disc. Sometimes if you compress it, some of that disc fluid can come out, and that is how people say that is what a slip disc is. And that usually takes longer to recover because obviously the body has to try and almost like suck the disc back in.
Yeah, it's about inflammation as well. As soon as that comes out, your body will react and create strong inflammation to try and, because it's like a new product. And so the body reacts directly with inflammation. So it's trying to get this inflammation down and trying to teach your body that it's okay. And that's one of the main things as well.
Another big one is a joint irritation. Again, kind of slightly touched on it. In particular, you've got, so in your spine, you've got your main big bony bits here along the center, which are usually the ones that you can feel. They stick out in the middle of the spine. But you do have little sides
on the sides
as well. And they form little joints, and we call them facet joints. And sometimes these can become irritated and aggravated. Almost, it does act like any other real joint in the body, where you can almost sprain it if you do too much, or if you're holding yourself, putting yourself into kind of extreme positions. And I guess like any other joint, you can get swelling into it. And a lot of time when people come in, they don't have these typical disc symptoms. So the typical disc symptoms are things like they felt the back go, they were very immobile, they can't move forward or backwards, pain on coughing and sneezing. They're your typical disc signs. So if you're coming in to see us and you don't have any of those, but you notice you're very stiff and into certain movements you feel quite sore and quite stiff, then it's most likely that you've probably irritated one of these side facet joints.
Yeah, so these facet joints are the back. So what happens there, like this, top to bottom, let's show here. So when you go forward, they come apart from each other. So when you bend forward, when you go backwards, they come closer to each other. Same thing to the sides. So they come closer to each other when you go to each side. So one of the typical signs and one of the tests that we do to differentiate between a disc and facet joint is the bending and the arching back. So the arching back with the facet joint is going to be very, very painful for you because you're pressing the joint together. And if the capsule around the joint is very inflamed and irritated, that's going to be painful for you. Whereas when you're bending forward with a disc problem, you're putting more pressure and more tension through the disc, which is going to increase the pressure again, and that's going to recreate the pain of your disc injury. So that's how we try to differentiate. It's not perfect science, but it's one of the things that we really try to figure out, because the treatment is going to be a little bit different, and we're gonna try to make the progress as well different. So you want to make sure that we know exactly what's happening into the back. But facet joints is very, very common as well. That's a bit small when you've done so that in sports. So in sports where you have some extension movement. So if you do throwings and you have to go back and then forward. So that's a lot of arching the back, irritating the facet when you're arching. It's also if you've actually pull heavy stuff. So if you pull heavy stuff, you can see how you're going to lean backwards. And sometimes if it was very heavy and you suddenly have a jarring movement backwards, that can irritate the little facet joint. That's going to be a bit more of the mechanism of injury for facet joints at the back. But you usually wouldn't get anything, any pain down the leg, so it wouldn't affect any nerve when you have those. You might get some buttock pain because the pain refers a bit low down in the buttock, but nothing like pins and needles, numbness, or anything going below the knee at all. So
yeah, I think we should say in the lower back you do have quite a lot of different nerves, and these nerves do supply your legs, but also kind of into genital region and also bladder and bowel function and stuff. So just as like a flag up, if you do have any crazy things like that happening, you must go and see somebody. But the sciatic nerve that we've spoken about does come down the back of the leg. But people also, if they've irritated their lumbar spine, so the lower part of the back, they can also get referral coming around into the groin, or sometimes down the front of the thigh, and that's more associated with something called the femoral nerve. So your femoral nerve kind of comes a little bit higher up in the lumbar spine, whereas your sciatic nerve is a little bit lower down, and that's the more common because that's kind of where quite a lot of the load will go through into the lower part of the spine. But yeah, it is usually kind of nerve symptoms, so tingling, pins and needles, burning, numbness, weakness, anything like that is usually more associated with like disc problems, isn't it? Especially big patches of numbness, muscle weakness.
Yeah,
and that's something not to leave, it needs to be addressed.
yeah, definitely. And as you said, so if you're there at home, you've just had low back pain a couple of days ago, and you get some changes in your bowel or bladder motions, or you feel like you're a bit less sensitive, or you can't really feel when you're wiping yourself, things like that, definitely go see someone, talk to your GP. That needs to be assessed and make sure that everything is working properly, okay?
Yeah.
But that's kind of the red flag that make sure that you have a look. Otherwise, I think on the lower back, one of the main things can be muscles as well. There's a lot of muscles, and we use so many muscles in general every day when you're lifting, when doing stuff. So sometimes it can just be a bit of a muscle tear, or I see a lot of muscle spasm. And they come in, and the muscles, when you're touching them, when you're having a feel, rock solid. So they've completely come into spasm, contracted, and they're not letting you move at all or do any movement. And that can be very painful. So that will be for us, especially you, Jenny. I feel like you would really go through that and work through the muscles to allow it to relax and for you to move better after, just to get better.
Yeah, I think usually those people that come in with more like the muscle spasms are those that don't have real symptoms during maybe an activity, but probably wake up the next day and they feel quite stiff and rigid and they're struggling to move. So quite commonly I see that again with athletes, more in the sports that involve maybe a lot of twisting or like leaning over slightly, so like hockey players and things like that. If you've not been doing it for a while, cricket players can get it. But also I think in general population, I've seen it quite a lot where people maybe come in and they've spent the day gardening. So they've kind of spent the day leaning over planting flowers, or they've been mowing the grass where you're slightly hunched over the mower. And that kind of long prolonged position can cause that tightness in the muscles. So if you do notice that you're doing activity, you don't really have any pain, you feel fine during it, you feel fine afterwards, but maybe it's the next morning where you get out of bed and you're all very stiff, it's most likely that it is more muscular. However, you can obviously get disc problems and joint problems that come on later as well. So again, it's always good to get checked out, but that kind of leads us on to treatments. If it is more of a muscular tightness and issue, I spend a lot of time working through the soft tissue, so massaging through the muscles, doing a lot of stretch work, giving a lot of mobility exercises. So for the lower back, I like quite a lot of the yoga mobility work. So the kind of cat stretch, child's pose, things like that. And usually if it is more muscular based, I kind of recommend that they maybe have some hot baths, and maybe apply some heat to it, because what we're trying to do is really try to relax all of that all of those big muscles in your spine, really just try to settle and calm them down. And with the back, I think Maud, you can probably give more information about this, but with all injuries, particularly with the spine, it used to be that you hurt your back, lie down, don't move, stay in bed, let it recover. Whereas now you've got all of the new research and everything that now comes out, which says the complete opposite, that actually the more you move it, the better you feel, which I think a lot of people, when you kind of say that to them, they go, oh, actually, yeah, when I'm doing activity and when I'm walking and moving, I feel pretty good and okay. But when I kind of try to stand up from sitting down from long periods, or when I wake up and try and get out of bed first thing in the morning, it's a nightmare.
Yeah, and that's huge, because we've come a long way from that, and that's a lot. Now it's really about keeping active and keeping mobile when you have low back pain. So some people will be like swearing at you, I can't move, like it's too painful. It's
Yeah.
gonna be slowly, it's gonna be about doing a little bit, walking around the house, just kind of, you need to get your back to keep mobile, because if you just stop, rest, stay laying down for the whole day, everything is going to stagnate, everything is going to contract and not move. And when you're going to try and move again, it's exactly what happens when you sit down for a long period of time, when you're during the night, when you're sleeping. It's going to be very, very stiff and really painful, because the inflammation basically has stopped and stayed in one position. So you had no blood flow, no drainage, nothing like that happening when you don't move. So whilst moving, you're actually pumping the blood through the muscles, you're pumping the blood through the veins, you're draining as well the inflammation of the area. So you're creating new fresh blood coming in with the nutrients and everything that needs to heal. So as soon as you move, you're helping the healing process actually. So we're not saying kind of go for a run or like lift heavy things, nothing like that. It's just about kind of gentle walking, gentle mobilization exercises to keep the muscle active, for them not to go into that really tight contraction, and to keep the blood flowing to help the healing process through the back. Really, really important. You can also help doing that by using heat and cold as well. So swapping between both can really help. So if you put an ice pack wrapped in a towel for about 3, 4 minutes, and then heat afterwards, and you just swap around, that's gonna help to. So with the cold, you decrease inflammation, and with the heat afterwards, you basically bringing in fresh new amount of blood through the area and helping with the healing process and the muscle relaxing. So that can be a really good thing to try and ease off your lower back pain at the beginning when it's just really unbearable. Um, Definitely moving, and we are like trying to help you as best as we can as well, because during treatment, what we do is exactly the same. We're moving your joints, we're moving your muscles, relaxing that, helping the blood flow, draining, so pumping the blood through your joints, everything like that. So that's what treatment helps with as well.
Yeah, so like the hands-on treatment that I do, let's say a disc or a facet comes in because we've addressed the muscles,
Mm-hmm.
is I guess you're probably the same. I do quite a lot of joint manipulation, mobilization, so really trying to get through the joints that are stiff, that have quite a lot of inflammation in, to get them moving a bit better, to try and free it all up. As you said, move all the swelling away, bring all the lovely fresh bits, like nutrients in the nice fresh blood. Also, I do quite a lot of massage. In the initial phases, because a lot of people, it is natural to kind of brace and to maybe not move as normal as like you would do day to day. So you find that a secondary issue is all those muscles get very tight, and then that can hinder you from obviously moving and doing things that you need to do. So do quite a lot of massage, acupuncture into the lower back as well. And I think a big topic which I usually talk to my patients quite a lot about, which maybe Maud, you're probably best for answering this question, is a lot of people want to go, if they've got a bad back, to chiropractors, and they want to have their back manipulated, so clicked. Can you tell us maybe a bit about this, and if that's appropriate for lower back injuries, and when to maybe have it done?
Yeah, so manipulation is a technique that osteopaths use and chiropractor may use. So we use it as well. But we have a lot of range of technique as well. Chiropractor tend to concentrate as well a bit more on manipulation. So that's basically a quick, sharp movement through one of the joints in your spine. And you can have it anywhere, but in that case, we're going to talk to the spinal manipulation. It's a quick, sharp movement to the joint in your spine. Sorry, that basically it's gonna help the joint from moving better and help the muscle around it to relax. So it shouldn't be any painful or anything like that. It sometimes creates some popping or clicking noise. With low back pain, I would say that it can be very helpful to have it done. For fascial irritation, for example, it can be very nice to open up that joint and create some space and release through the joint. With disc, however, if there is a strong disc injury, that's a contraindication. So you want to be very careful on where you're doing that manipulation because you could potentially put more tension through the joint and then create a disc problem a little bit worse. But the osteopath and the chiropractor would know exactly where to do it, and we can be very precise. So if they do it, you can trust that it can be in an area that is with no danger. What I tend to do with low back pain, I tend to leave that alone. So I tend to do just articulation, so just a bit of mobilizing through that area. And I would do manipulation higher up, so through the thoracic spine. Because as you touched a bit earlier on, right at the beginning, some tension and some restriction higher up in the spine can just put more load through the lower back. So if your lower back is already in incredible amount of pain and a bit injured, you don't want anything more, like any more tension to go through there. So I'd look higher up to see if there's anything I can release above that can help with decreasing the load and the amount of pain through the lower back. So that's how I work usually with kind of low back pain. I'd look above and below as well and do some manipulation above on the thoracic spine to
Yeah.
help the lower back.
I guess a follow-on question from that, I'm just thinking, because this is what patients always ask me. Um, if I have raging leg pain, so like sciatica, should I
Yeah.
go and get back clipped? Or
So
would
you
you?
can, but you would try to avoid to get it clicked where the segment of the disc is. So
Okay.
you can get it clicked higher up, so where there's no injury and where anything is fine, that's no problem at all. But they wouldn't be the best thing to do it on the area where you have that joint and that disc protruding, which the practitioner should know about, and they wouldn't kind of try to do it. So if you do see someone and you get some strong pain, they should know about that and they should kind of work appropriately and just maybe manipulation, which can really help, but above or below rather than on the site of injury.
So another good thing that I use is taping. So taping can help to offload the structure. So all these lovely colourful tapes that you see on athletes. Um, but another thing that I find I don't recommend much for peripheral joint problems because you're kind of using them all the time, and the pain maybe isn't as bad as lower back pain. Is those who can't seem to get rid of the pain at all in their lower back with movement. So you've got quite a big disc bulge, so maybe a disc prolapse, quite a lot of this fluid has come out, you're in severe pain. There are these cool little machines called TENS machines. So quite a lot of pregnant women probably know what I'm talking about. A lot of men probably don't have a clue, but it's like a little device where you can stick on some pads around the area and it provides you with pain relief. Obviously, we have to say you need to make sure, maybe talk to a doctor, make sure it's appropriate. That's something that you can come in and discuss with us, because I know you can't do it on certain things if you've got like pacemakers, heart problems. But that's always something I think sometimes, particularly I guess for your average people that you see more, maybe not with athletes, but I've had people that have come in and they are like, they're in so much pain, and no matter what they do, no matter how they lie, no matter how they sit, no matter how much movement they do, they can't get rid of the pain. they can't get rid of the leg pain. So that might be a good option to have a look into maybe using a TENS machine, just to try and give you that pain relief, not for a long term, but more so that you can, as we keep talking about, getting that back moving. So it gives you that bit of pain relief so that you can do the movements, and so that you can try and kind of get it moving and using it as normal as you can, to then obviously start the recovery process.
Yeah. We're not really, prescribing anything because we're more in the holistic approach and we don't want to prescribe things. But I always say if you're in an incredible amount of pain that you can't move from your bed, like call your GP. Some people hate taking painkillers, but sometimes, if you just can't move and that gives you just that little bit of relief. And it's also a mental thing, isn't it? If you're constantly in pain, mentally, it's very, very hard and draining. If you can't sleep because of the pain, if it gives you those hours of sleep, if it gives you a little bit of rest, sometimes it's worth it because healing process also happen when you're sleeping. So if you are really tired, if your body's drained, this is not how your body is gonna heal in the best way. It's not gonna heal the quickest in the quickest way. So you want to get those good sleep. You want to get a resting body, your mind at peace and things like that. So sometimes it is helping you. So I would never go against it if that's something that someone needs. So you can think about that as well.
Yeah. So the last thing that we're just going to quickly touch upon is your exercises. So me personally, my practice is always based on your exercise rehabilitation. I always say it in every power hour, I hammer it home, no matter how much hands-on treatment you have or rest, you need to do your rehab to build up your strength to ultimately prevent this from happening again. The most common question that I get is this pain ever going to go? Am I now going to be susceptible to having this happening again? And the kind of main answer to that I give is not if you do your exercises and your rehab. And I think the main exercises that I personally do are initially to get the back moving properly, so more like the stretches and mobilizers through the spine. So as I said before, like your yoga exercises, some like knee drops just to try and get some rotation through the spine. And then when your pain levels start to settle, that's when we start looking at doing exercises for your glutes, so like glute bridges or clams, and for your deep core stabilizing muscles. So usually I give them the basic stuff, so we're trying to activate through your pelvic floor. But a good thing to then go on to if you do struggle with your lower back, I would 100% say find a Pilates class and get going with some Pilates. A lot of people sometimes wonder why we're strengthening the core and not maybe focusing all the attention on strengthening your back muscles, purely because we live in a world where everyone is very weak through their deep core stabilizing muscles, and we overload our backs so much. So it's just trying to regain that balance. Is there anything that you would avoid more with, let's say, like an initial stage of a back injury or a disc or?
So definitely starting with just kind of the stretches, gentle mobilization, not going directly through really strengthening the muscles, just because you want to get your back to settle a little bit before putting more pressure through it. But as you said, definitely core buttock. Basically, while you're doing the buttock attaches from your hip and then onto your pelvis and your tailbone that we looked at the bottom. So that's directly linked with the segment right on top. That's going to have an effect on how you're moving your pelvis and on how much you're moving your hips. And then as a result, how much load you get through your back. And then the core muscles, they basically wrap around your belly, and then they go all around all the way through the back. So it's like if you have straps that you pull and you wrap around, they just stabilize through there. So you can see how that's gonna help as well, how much you arch, how much you bend your back, and how much you move, and how much you're using them, especially when you're lifting those things, when you're bending down, lifting that that heavy bag or that heavy storage or object. Okay, and the stronger they are, the more they're gonna activate when you're doing those bending, those activities. And that's where you want to get to. It's that your muscles naturally engage and naturally help to support your back. Rather than if it's weak, everything goes through the back, through the joints, and that's when you start getting a bit of injury.
Yeah.
So definitely do some strengthening through there, and yeah, I've seen lots of people just getting better and better with exercise and stronger and feeling better as well in themselves. So I think is the right route.
So I think to kind of summarize, I would say if you have got a severe lower back pain that's come on quickly, be aware of your symptoms, but 100% go and get it sorted. If you don't get it sorted, you don't know how long this is going to be debilitating you for. And also, it leaves it open for you to just constantly get back problems. If you do have back pain or leg pain, try to keep moving, apply your heat, your cold, and again, go and see somebody. And make sure you follow it through with your exercises, your rehab, get you back to being a lot better and a lot stronger than you were previous to the injury. And have a real think about long-term measures. And that also counts for prevention. So if you feel like you have a weak back, quite a lot of people come in, they say, oh, I feel like my back is weak. You maybe are looking to start doing a new type of exercise, which is different. Then I would 100% say look into some prevention things. Don't get to the point where the back goes and you have to sort it out. Do something to prevent that from even happening. Build up your strength from the off with Pilates. I highly recommend, just because it does everything that we've said. It really tightens up through your abdominal muscles, keeps everything strong, keeps your back nice and strong, and that's what Pilates is geared towards, back health really. A lot of people kind of ask me the difference between Pilates and yoga and what one's more appropriate. I mean, I would say yoga is more stretch based, trying to increase your flexibility, helping with mindfulness and things like that, whereas Pilates is a lot more strength based. So I would opt more for your Pilates. A lot of people then say, oh, but I actually noticed that I'm also really not flexible through my spine. I can't touch my toes. That's why I do yoga. But if you start to use your muscles more and properly, you might find that actually you can get more movement. So do you have anything to add, or is that what you would also recommend?
Yeah, definitely. Same thing. I recommend a lot of Pilates. I think it's a great aid through recovery and great aid through strengthening. One thing that I wanted to add is just be wary of any low back pain after a big fall or anything like that. Just get that checked out as well, just in case anything has gone a little bit more injured, like a fracture or anything like that. You want to make sure that there's nothing like that. And then a road traffic accident as well. Any car accident, obviously a lot of, and it can create some low back pain that are quite nasty. So we can really help through those, and I love treating those because basically the force of the accident can still kind of stay within the body, and we can help to just release the body from that shock and that impact that happened through there. But there's so many things we could talk about, so many different types of ways that you could get low back pain. It's crazy.
Yeah.
So definitely try to get it sorted if you need help, because it is quite painful to get low back pain. Otherwise, if you have any questions, comment down below and let us know. If you need any help with your lower back pain, just give us a call as well. I'm in Cambridge and you are more around London, Hatfield.
Yeah, Hatfield, Fitness First. But we have, like, mostly all of our clinics, I think there's osteopaths. You guys obviously specialise more in the spinal stuff. So yeah.
Yeah, and now we have Pilates classes online as well, which is a great help. So you can stay at home and do your Pilates workout and session from your bedroom. So that's a great thing, I think. Yeah, so any questions, comment down below, and otherwise, it's see you later for us, and talk to you next week.
Speak to you next week,
Bye,
guys.
everyone.